WellSpring Resources, we are a mental health and substance abuse agency in Alton and Jerseyville, and already ran across a couple people who hadn't heard of WellSpring. Is anyone who has not heard of us, raise your hand. Okay, that's not bad. We actually have been in business for over 50 years. We were formerly known as Community Counseling Center. Does that ring a few more bells? Okay. We changed our name just about a year and a half ago because, one, we want to help reduce stigma attached to getting counseling. Unfortunately, with counseling in the name, I think a lot of people probably were afraid to come see us, but the kids and teenagers were the most vocal about it and said, I'm not going somewhere that says counseling. And so, plus we also wanted to offer more than just counseling services, and we do have a wide array of services. And now WellSpring is we're focusing on individual wellness for people. We know that a person doesn't have to have a mental health diagnosis or a mental health problem to benefit from counseling, or just having somebody to talk to. We have all kinds of services at WellSpring now, and of course the most well-known is the counseling services. That we have outpatient counseling where a person comes and meets with a counselor for a 45-minute session. They see adults, kids, all ages. But some of the things you may not know about is that we actually have counselors who go out into the community that meet with kids and families that are having maybe some issues. That is our community support, and they actually meet with the kids at the schools, with the families at the homes, so that they can work on the whole family system. Because let's face it, if a kid's having a problem, there's usually other issues going on in the household or at the school or whatever. And so we actually get out there into the homes with them. And we do that throughout Madison County. We have community support for adults who do have serious mental illnesses. As most of you are probably aware, they have been and are continuing to close mental health and developmentally disabled facilities throughout Illinois, which means, or even for the ones they haven't closed, we still have Alton Mental Health, but they're decreasing beds to where there's just really not enough room. And so a person with a serious mental illness may have, in the past, if they were having an episode, they would go into a hospital. But unfortunately, there's not necessarily a bed at this point. There's not a place for them to go. And so what we do is we go out and work with them in the community to try to keep them stable, to keep them independent and in their homes. At times they may need more than that. Maybe they can't live independently at that time, at which point we have group homes. And a lot of people, even if they've heard of us, aren't aware of our group homes, but we have several through Alton and East Alton. Matter of fact, there's one just down the road from us here, where if a person, they've got a serious diagnosis, they can actually move in there for anywhere from 18 to 24 months, where they learn to live independently. And it may be things that they didn't learn initially, or maybe they need to relearn such, independent living skills such as, cleaning up after themselves, helping make dinner, planning meals, paying their bills, and of course getting along with others, because that can be an issue too. But what we love about our group homes, it's not just a place to stash people. It's not a place to keep them out of sight. It's a place to teach them to live on their own. And so they actually move into apartments when they graduate from us, and they can live in any apartments they want to. But we also have some assisted living apartments where we do have someone on staff throughout the week, and then emergency numbers on the weekends, where they also do activities and things just to try to keep people active, because unfortunately with someone with a serious mental illness, they do have a tendency to withdraw and be on their own. So we really try to keep them engaged in doing things outside their homes. And so we're real proud of that. We have had people who are so successful, they're able to then get part-time jobs and do things in the community and participate. And that's pretty amazing on where some of these guys have come from. We also have a senior program where we specifically go out and meet with seniors who they may have a mental health issue because, say, they've always had one and they're aging now, or because they've developed one. Unfortunately, a lot of seniors get depressed. If their significant other has passed or their kids have moved away and they're on their own a lot, it can be very depressing, unfortunately. And so we actually have counselors who go out and meet with them. They help them to get to their doctor's appointments, set up their doctor's appointments, make sure that they've got their medications set up in a way that they're taking it every day. Basically just helping them to live independently longer also. And in with that is our caretaker program. We've also found that caretakers are not very good about taking care of themselves. Does anybody know somebody who's taken care of a loved one? Unfortunately, everything comes before them. And since they're not very likely to take care of themselves, that doctor's offices, social workers, anybody can refer this person. We call them, ask them, would you like us to come out and meet with you, just talk with you? So we meet with them, try to provide emotional support, but also resources. A lot of people, there are tons of resources in our area, but finding any central location to find all those things is very difficult. And so we help them find resources. Maybe it's some kind of respite service so that they can go out and, get their hair done or, take care of some things. Because unfortunately, it can be a very difficult process. We have substance abuse services. And they are outpatient services, so someone who has an alcohol problem, drug problem, they can come see us. And I was just talking with Brad about we have DUI services now. And so if someone gets a DUI, unfortunately, they need to get an evaluation and then they have to take risk education classes. And we provide that at our office. We do have some monies available for people who have little to no income. They do have to bring proof of income, but they can actually get those services for free. One thing I haven't really mentioned is all these counseling services. We are a nonprofit agency, and that's something I'm very proud of because it's easy then to share, this is a service that we are providing. We do take insurances and all. But we also see people who have a medical card, Medicare, or who have no insurance whatsoever. And because the state continues to cut funding or not pay their bills, we are doing a lot of fundraising these days. And we just had our trivia night. It was our second annual trivia night, and it was a great success. So next year, about this time, if you hear about our trivia night, you'll have to come. It's lots of fun. We'll be planning a spring splash where we actually honor mental health heroes, or we just call them heroes now. People who have provided services to people in the community, who are making a difference in their community. And so we want to honor those people. And so we'll have a dinner around that, do some silent auction baskets, that sort of thing. We do have a sliding fee scale for those people who do not have any income. The vast majority of people don't pay anything for their counseling. The state now makes Medicaid folks pay like $3.95 to see the psychiatrist, so we also do that. We also have a program called Methadone, and I don't know, has anybody heard of that? Methadone is something that often gets a bad rap. It is for people who are abusing opiates. And that alone will, scare a lot of people. But unfortunately, if you read the newspapers, watch the news at all, there are people dying of opiate overdose all the time. That is your Oxycontin, your Vicodin. The pills are a big part of it, and unfortunately, our teenagers are starting to use that now. They'll read their parents' cabinets, their grandparents' cabinets, and so one of the things part of what I tell people, a public service announcement, is to be sure and go through your cabinets. They have drug take-back days frequently through the police stations. where you can actually take back, like, you know, my daughter had her wisdom teeth removed, so we had something in there, I don't know, Vicodin or something. She didn't use them. There's no reason for it to be sitting up there. So the next take back, I'm going to take that back to them. Because apparently what the teenagers are doing are grabbing pills out of their parents' cabinet, taking them to these parties, dumping them in a bowl, and they just mix them around, grab a handful. And I don't know about you guys, but I can even imagine just in my cabinet, things that would be a very dangerous mix. It's pretty scary, and as I said, you know, even for my daughter having her wisdom teeth, or God forbid my dog actually got opiates the other day. It's like, oh, that's interesting. But, so it's not just what you picture as an opiate abuser, a heroin user. Unfortunately, it's hitting middle class and hitting it hard because it's a very inexpensive drug to get. And so when you hear about, oh, all the copper being stolen out of air conditioners, I know when we were building our new building, there were tons. I mean, we had to install cameras because people were coming and stealing metal. Those are usually people who are abusing drugs, because when they are, it is the only thing that really matters to them at that moment is getting that next fix. And they will do anything. They will break into your car, they will break into your home. They're going to try to find the money however they can. And so what we do is provide this methadone, which is a synthetic opiate, basically where, and I don't believe it's an opiate, it's a synthetic product that allows them to not get a high off of it, but they can take that each day and go back to living productive lives. Most of these people, they'll put aside their kids, their jobs, their families. They will really lose everything before they'll ask for help in many cases. And we've seen people actually be able to rebuild their lives, getting their kids back from DCFS or a family member, you know, getting a job. We're open very early in the morning so they can come in before their job and then go to their job and just live regular lives. And that's really exciting to see. And if you ever want to know more about that, I'd be more than happy to share my information, just because that is something that I had some negative thoughts about when I first started, and I've learned so much and saw what it does for people that it really has changed my thinking on that. Let's see, I think I've gone through our services at this point. We're adding services all the time. I'm going to see, I can open it up for questions. Anybody have questions? One of the things we are doing is we have partnered with the Alton School District, and more recently, I believe the Roxana School District, and we actually provide counselors in their buildings so that kids can access counselors more easily, and the social workers can refer people to them without having to rely on the parents to bring them, because unfortunately, you know, some of the kids that need it the most, the parents aren't going to follow through on it. And so we feel that that's a really good partnership. We also have an office in Alton, or in Jerseyville, excuse me, and that was when the community counseling center there, because of state funding cuts and because of the state not paying their bills, they actually could not pay their employees anymore and had to close down. And we got so many calls from that area because we were the next closest, that we actually were able to open up an office there in Jerseyville so that we can still serve these clients. Because unfortunately, there's the need. And as long as there is the need, we want to be able to serve people. That's all. Does anyone have any questions for me? You all are so quiet. Hope I didn't put you to sleep.
More questions?
Thank you.
Thank you.